Hello, I am Dr. Reddi Prasad, Chairman and Head of Department of Interventional Radiology at Manipal Hospital's Old Road, Bangalore.
Hi, I am Dr. Gayathri Karthik. I head the Department of Obstetrics and Gynaecology at Manipal Hospital, Bangalore.
We are really excited about the launch of Fibroid Clinic at Manipal Hospitals.
What are fibroids? Fibroids are benign tumors of the smooth muscle wall of the uterine wall. They are not always single, they may be multiple. Now, how do we decide whether you need surgery? Not all fibroids need surgery. We keep your interests in mind and then offer options. What are your options? You can have medical treatment, but not for all fibroids. You can have non-surgical treatments, which includes a uterine artery embolization, and you have surgical options. Medical options would be in the form of tablets, and if the treatment necessitates doing a uterine artery embolization, I hand you over to Dr. Reddi Prasad, who is excellent at doing this.
Thank you. Fibroids are very common. Approximately 1 in 3 women can have fibroids during their reproductive age. Uterine artery embolization has been performed over the last 3 decades, and it has been shown to be an excellent alternative to surgery. Uterine artery embolization is a minimally invasive procedure, which means we perform this procedure through a pinhole. There is absolutely no scar, no blood loss, no risk of infection or very less risk of infection. Patient gets to go home the next day after the procedure, and the recovery is really quick. Within 2 weeks, they are back to their work. Those are the advantages of uterine artery embolization. Here at Manipal Hospitals, we have the state-of-the-art cath lab equipment where we can safely perform this procedure, and if required, Dr. Gayathri would be performing surgery on those patients who would be suitable for surgery, and I request her to talk about surgery.
So, though uterine artery embolization is a wonderful procedure, there are times the patient may not be fit for undergoing this procedure, in which case you're left with surgical options. Surgical options are of 2 types. Either we remove only the tumors in the uterus, or we remove the uterus as a whole. Now, removal of these tumors can be either hysteroscopically, wherein we go into the uterus and remove the ones which are protruding into the cavity. If they are in the wall of the uterus, you can remove only the tumors by procedure called myomectomy. This can be done as an open procedure. This can be done minimally invasive with laparoscopy or robotic surgery. Or you can go in for a hysterectomy, where we will be removing the entire uterus, cervix and tubes. Now, all these procedures can be done minimally invasive with fine scars, just a few of them, a few millimeters long, and you are absolutely comfortable and you go home the next day. Robotic surgery has been in vogue in the last 10 years at Manipal Hospital, and we have had excellent results. So, with the launch of the Fibroid Clinic, you get to meet both Dr. Reddi and me, and we decide, we get your blood tests done, we do your ultrasound scan and an MRI, which will help us locate where each fibroid is and help us decide what is good for you. Then, keeping you in mind, we decide, we have a discussion with you and decide what is good for you. Dr. Reddi.
Once you see us in the Fibroid Clinic, our motto is that you are very well informed with all the treatment options, and by the time you walk out of the clinic, you have the knowledge and you are empowered to make a decision to see what is the best suited treatment for you. Once you have made that decision, then you are followed up and the treatment is offered all under one roof. Both the interventional radiologists are available, gynecologists are available, and we have the state-of-the-art theatre facilities and state-of-the-art cath lab facilities, and you are taken care of. We will take care of you.
Come today to the Fibroid Clinic if you have one.
All the very best.